Technique number 5 of our 7-step program is called CBT, Cognitive Behavioral Therapy, CBT. We have cognitive distortions. Now, when we have feelings, if I feel anxious, I feel depressed, I feel sad, that's our emotional self. Remember, we have a 3-part self. We have a body, behaviorally, a guf. We have a ruach, an emotional self, and we have an intellectual self, a cognitive self. We live here in our emotions. We live in our emotional selves. Happy, sad, motivated, frustrated, annoyed, angry, happy. Every day we live here. We can either choose to go down into our gravity and act on them and be angry and snap at somebody, or go up to my mind self, go against gravity and say, how can I deal with this situation? If I have a wheel of strengths over here, remember who I am, have an emotional self, ground myself emotionally, live in the present tense, circle of control, let my thoughts pass, I can deal with the situation. What happens with the thoughts? The thoughts come along, and because I have a feeling of negativity, of frustration, my feelings come from thoughts. I'm a holistic being. I have a feeling, an emotional self, an intellectual self, and a body self. My mind tells my feelings how to feel. I think a certain way, and I emotionally feel that way because of my thoughts. And then I act on them by being angry or slapping someone, God forbid, or being negative or sleeping away the day, my body. But it starts here. My mind affects my feelings, which affects my body. Now, if we go into the distortions of how I think, these distortions are causing me to feel frustrated, angry, hurt, sad, annoyed. So I have to be aware of my emotional self here and ask myself the following question. What is the cognition, the thought, which is causing my emotional state? Let's say I'm worried. So I'm worried about what? I'm worried about my mother-in-law coming. So I say to myself, I'll never succeed with my mother-in-law. So I'm worried, and I get butterflies in my stomach, and I feel nervous and frustrated. The reason is because I'm saying something in my mind to myself, which is causing me to be worried and having butterflies in my stomach. What am I saying? I have to identify, uncover in my subconscious mind what I'm actually saying to myself, which is causing my emotional upset. What am I saying to myself? I'll never amount to anything in my mother-in-law's eyes. Now let's analyze that statement. Is that all or nothing thinking? Black or white thinking? I'll never amount to anything in her eyes? Yes, because I could change. I could improve. I can improve myself. I could try to do better. I can deal with her with finesse. It's not true that I'll never be good in her eyes. So I am guilty of thinking that way, which is causing my emotional upset because I am thinking in a distorted way. This is called a cognitive distortion. All or nothing thinking or black and white thinking is called a cognitive distortion. Number 2, am I overgeneralizing from that one situation 2 years ago when I messed up with my mother-in-law? And I'm saying, well, all situations will be like that? Yes, I am. I'm overgeneralizing. I'm taking one incident and I'm blowing it out of proportion and I'm saying all the situations will be like that. That's overgeneralizing. Am I maximizing negatives? Yes. All the negatives that she said on that trip that she had 2 years ago when she came, right? I am focusing on the negatives. But there were some positives, and I am minimizing the positives. So this is a distortion because I'm belittling, making small, minimalizing the positives, and I'm maximizing the negatives. I'm saying it was a horrible, terrible trip. So I awfulize. I use terrible words like it was horrible, it was disaster, it was tragic, right? And I freak myself out with that negative language. Number 5, am I a fortune teller? Every future event is going to be like that first one. Now, as far as I understood, Nevi'us, prophecy, ended at the end of the second Beis HaMikdash. Time of the second Beis HaMikdash. So why am I still fortune telling, saying that in the future I'm always going to be bad in my mother-in-law's eyes. I'm fortune telling. I'm not a Navi. I can't be a Navi. I can't tell the future. Stay in the present. 6, labeling. I am a failure. I may have failed last time, but I am not a failure. Right? I'm labeling myself. I'm personalizing the event by saying to myself that I am a failure. I'll always be a failure. Right? I didn't do well in that job. I'm a loser. No one's a loser all the time or a failure all the time. We make mistakes. We have failings, but we are not a failure. That's a cognitive distortion. Number 7, shoulda, woulda, coulda. I should have, could have, would have. That's all in the realm of fantasy. I should have done this, I could have done that, if I would have done that, then nothing would have changed. That's all fantasy. That's all in the past. Or I think I should do something in the future. That's living in the past, living in the present, but it's not living in reality. That's fantasy thinking. That's a cognitive distortion. I'm avoiding the reality of the present. And number 8, blame. I'm blaming my mother-in-law, I'm blaming myself, blaming my wife, blaming my kids. I am blaming someone else instead of living in reality and taking responsibility for the present tense. I'm blaming somebody else, either self-blame or blaming someone else. All of these 8 distortions are called cognitive distortions. Now, let's apply them to other statements we might make, besides my mother-in-law. I use mother-in-law because it's a traditional joke. But there are other statements I make to myself, like, I am not good enough. I'll never be good enough in my eyes of my parents, or in my boss's eyes, or my wife's eyes, or my husband's eyes. I'll never be good enough. Well, it's all or nothing thinking. I'll never. It's overgeneralizing for those times that I made a mistake, yes. Maximizing negatives, yes. Minimizing positives, yes. Fortune telling to the future, yes. Labeling myself as a loser, yes. I should be better, could be better, would be better, fantasy. Labeling or blaming myself, my wife, yes. That statement of I'll never be good enough is guilty of 8 distortions. What other statements are you saying to yourself? Or I'll fail. How do you know? It's guilty of these distortions. Or things are bad with my wife and they'll never be better. Who says? They've been bad now and they'll always be bad. Fortune telling, all or nothing thinking, overgeneralizing, fortune telling, labeling, blaming. I'm not thinking straight. This technique is a thinking technique. It's a cognitive technique, part of technique number 1. We're talking about technique number 5 right now, but it is main technique number 1, which is a thinking straight technique. It's a cognitive behavioral technique to reframe my thinking and think straight. Thinking incorrectly causes anxiety, distortions, and emotional upset. If I change my thinking, my mind, it'll trickle down to my heart and I will feel differently. So now I want you to do is I want you to take that statement you wrote down, the cognition, and I want you to change it to the proper statement. My mother-in-law is coming and I'll do the best I can to give it a positive experience. My wife and I have had difficulties, but I'm working on it and I'm going to go to counseling and I'm going to work on it and improve our relationship. My children are not doing well in school and they're not behaving, but I'm going to work on parenting techniques and improve myself in terms of family therapy, and we're going to get better. I'm not doing well in the recession, but I'm going to work with a headhunter and a CV resume therapist, and I'm going to try to improve myself and get a better job. If I change the mantra, if I change the cognitive distortion in my mind and replace it with a positive statement, a healthy statement, a correct statement, I'll be able to restore inner calm, and then the butterflies in my stomach, the emotional upset will be cleared. If I think straight, it'll give me a sense of calm, equilibrium, and I'll be able to handle the challenge.